North Carolina Medicaid Managed Care Implications, a research paper, presented by Elizabeth K. Lackey, Individual Research Project Presentation, Mktg640, Fall 2019. Presentation contents. I'm going to go through an introduction and motivation slide to explain the reason for choosing this topic, looking at the key questions to be answered, background and basic concepts of why I chose this, research objectives, literature review and theoretical contributions, lessons learned, managerial implications, and then closing remarks or the conclusion. Introduction and motivation. So the reason that I chose this topic for the research paper is to outline the components necessary for successful transition and transformation in operating a tailored plan within the current Medicaid system and Medicaid transformation in North Carolina. To provide education for transitioning to operating in an 1115 waiver environment, to outline key questions to be answered that are critical for success within this transformation, provide background and information critical for understanding this change, and to provide implementation considerations to address rising healthcare costs, increase quality, and decrease cost. And lastly, to illustrate the importance of a system that supports whole person care for citizens in the state of North Carolina. So what are some of the key questions to be answered? What are important implementation implications learned from other states in transitioning to an 1115 waiver for the Medicaid program? Will this Medicaid system transformation bring better healthcare outcomes and reduce costs to North Carolina citizens? How will the role of care management contribute to success of the goal of better healthcare? How will consumer and member engagement contribute to the success of transformation? And will the state of North Carolina be successful in this transformation without Medicaid expansion? What are some of the background and basic concepts to this topic? The state of North Carolina applied several years ago to the Centers for Medicaid Medicare, or CMS for short, for an 1115 waiver. This waiver allows for maximum flexibility of healthcare service delivery inside the Medicaid program while also maintaining cost neutrality. It's not more money, it's just packaged in a different way. This waiver allows for the implementation of physical and behavioral health care, health home care management, or care management outside of health home is a cornerstone of the implementation of this program. This program and waiver allows the focus to be on social determinants of health. This is Maslow's hierarchy of needs. It's very difficult for somebody to focus on their diabetes care if, in fact, they don't have food on the table at night. Implementation of population health management models is critical for success. So the research objectives. Identifying how mitigating the rising healthcare cost is critical for success in healthcare. Addressing both the physical and behavioral needs of the Medicaid population improves the quality of the care as well as contains cost. Understanding how consumer and member engagement contributes to the success of this transformation. Understanding the implications of implementation in North Carolina. And then understanding the critical role that care management plays in success of this transformation. The literature review and theoretical contributions. So what does the literature say? The literature supports that there are opportunities to engage the Medicaid population through incentive programs. It also indicates that engagement through the use of technology is also an appropriate path. The literature indicates care management is critical for effectively identifying high-risk members and intervening in their healthcare journey. Use of value-based contracting for population health management is also a tool to use in how you financially pay providers differently, share savings, and effectively manage that high-risk population. What are the theoretical contributions then? Population health management strategies are critical for successful healthcare reform. The use of health homes and care management techniques provide better member care and outcomes. Holistic treatment of the population improves the health of the population. Proposed research methods. While we did not, for the sake of this project, have to carry out those methods, I'm going to illustrate several of the strategies that will be employed. Gathering information on member engagement, care management, and also marketing strategies, since part of the research paper focuses on transition in a business practice model. So those marketing strategies are important. Use of a mixture of both primary and secondary data. Primary data collection through the use of focus groups and surveys. Increasing name recognition and branding to ensure member engagement and stakeholder input. Then the use of secondary data for the implementation of appropriate interventions for care management. So why is addressing physical health and behavioral health important? According to the National Council for Behavioral Health, we will be unable to solve the quality and cost problems of the U.S. healthcare system until we address the healthcare needs of persons with serious mental illness and substance use disorders and the behavioral health needs of all Americans. That's a quote from the National Council for Behavioral Health back in 2017. Importance of member and consumer engagement. And I quote, increased engagement compels members to focus on high-value activities, making them more likely to take actions that prevent serious or chronic conditions. This leads to healthier members and populations, improved health outcomes, stronger plan performance, and a better overall healthcare delivery system, end quote. So what does that mean? It means that a focus on increasing the member and consumer engagement and stakeholder engagement through an increase in website activity, how you push information onto the website, how you have educational videos about health-related activities is important. Member and consumer education and outreach helps with educating about different disease models, different ways to employ healthy living strategies, increasing the literature for members and consumers, ensuring members are engaged in their health care through the use of innovative approaches such as incentives, as I mentioned earlier, the use of smartphones, connectivity for those smartphones to have reminders for appointments, to have a way to track information that helps them focus on their health. How will care management contribute to success? There are a few ways that care management is critical. First is using data to identify those high-cost, highly impactable members to assign care management intervention. Selection of those members with high utilization of avoidable services, emergency room and hospital are examples of that, but also looking at the impactability of those risky members. Assessing characteristics of patients with care gaps so that care managers can see where do we need to address some critical healthcare needs and intervene with evidence-based practices, because there's a gap in their care, and that gap in care could be leading to unavoidable services. So what about Medicaid expansion in North Carolina? I quote, "In North Carolina, there are currently 720,000 uninsured adults who would be eligible for Medicaid if the state expanded its Medicaid program. Of these 720,000, 587,000 would be newly eligible for Medicaid if the state expanded, while 133,000 are eligible for the program under current rules but are not enrolled," end quote. That says that we have a significant number of citizens in North Carolina who are uninsured and with the expansion of Medicaid could have health care accessibility, could have health opportunities. As recent as November 2019, the state has not passed a budget, and as such, Medicaid transformation activities have been suspended. The state has a continuation budget in place. However, that continuation budget is a continuation from last year so that the government can operate and items can be funded. However, the reason the Medicaid transformation has been suspended is that was not included in those continuation budgets. So without a budget, without the state voting to expand Medicaid, this has an impact to the implementation of a service delivery system that truly does embrace whole person care. This slide is a visual of who in the United States, what states have expanded Medicaid and what states have not. North Carolina, as you can see, is one of the 17 remaining that have not expanded Medicaid. So what are the lessons learned? 1115 waivers provide considerable flexibility in funding and avenues to test new approaches. It can be individualized based on a state's needs. Use the current system of managed care for behavioral health to build upon and lessen the chaos of transformation. Help to provide stability as the change occurs. Focus on the healthcare needs on a regional and statewide basis is key and critical. Other states' implementation can be used as guidance for North Carolina. Don't make up something. Use the lessons learned from the states that have gone before North Carolina to pull in the best components of those implementation standards. Care management is also a critical component for integrated care. What are some of the managerial implications? There are several. Understanding and employing change management strategies, acknowledging the ramifications of change on workforce, using small groups, small focus groups to identify champions for change and success. Entities like Partners Behavioral Health Management have an opportunity to lead and be a leader in the state, both internally with workforce and staff and externally with state leaders. In closing, member engagement, education, support, care management, and payer alignment provide a pathway to not only save dollars, but also to improve the lives of vulnerable populations. Advocate for the expansion of Medicaid in North Carolina to reach populations that benefit from integrated health care. And Partners Behavioral Health Management has an opportunity to embrace the change, be a leader in the change at the state, but more importantly, demonstrate investment in bettering the lives and health of North Carolinians. I'm including a reference page so you can see some of the quotes that I provided throughout the presentation and where those came from if you would like to read more. Thank you for your time and attention. For more information or questions that you may have, you can contact me directly, Elizabeth K. Lackey, and my email address is included as well.